Pelvic inflammatory disease. So, this disease is a bacterial infection, and from all the documentation and studies that I have found and did my research on, they all pointed to it being a bacterial infection. As far as to my knowledge and from what I was able to find, it is solely linked to bacterial infections. I don't think it's linked to anything like fungi or anything of that sort, so I wasn't able to find any information that would point towards this. But so, just a brief overview. PID is an upper reproductive tract infection. This infection can be either acute or chronic, and this can lead to other complications such as the infection spreading and causing infection of the peritoneum. This is known as peritonitis. Long-term problems of infertility, since it is disrupting the proper function of the reproductive system, and the possibility of even fertilized eggs growing outside the uterus, which can then lead to even further complications, things like organ damage or internal bleeding. Oh man, I think this is called, I believe there's a term, I think it's a ectopy pregnancy. I can't remember the term. I think it's ectopy. Man, that doesn't sound right. But so let's see. So as far as signs and symptoms of this infectious disease go, in most cases, a good sign or symptom is going to be some type of STD or vaginal infection, such as cervicitis or vaginitis. So it wouldn't be uncommon to see some type of lower abdominal pain or vaginal discharge and irregular bleeding. These are very likely symptoms. The infection can also spread into the urinary system as well, which would then lead to dysuria. Dysuria being the infection of the urinary system. Fever and leukocytosis are also two big red flags in response to the infection. So, the article and journals that I was able to find information on PID for all showed that it is there's not an exact pathogen or causative agent that leads to this disease, but rather there's a common list of causative agents that all kind of just point towards PID, or when somebody has PID, they usually find these causative agents linked to that. If they're left untreated or affect the right, or I guess wrong person, can lead to the spreading of this infectious disease to the upper reproductive system. So these agents are chlamydia, trachomatis, Neisseria, gonorrhea, and an imbalance of the natural vaginal flora. There seems to be a fluctuation on how it affects individuals, and it kind of seems to just be on a case-to-case basis. But these are going to be the main ones that, through my research, I found were linked to that PID. So let's see here. So this is my favorite, the pathogenesis of it, man. It's very interesting. So the infection usually originates from like a vaginitis or a cervicitis, so and can even involve multiple causative bacteria. So it's polymicrobial. Common pathogens that this may stem from, like I mentioned in the last one, it's going to be the chlamydia and gonorrhea. But as far as like the pathogenesis of it, the tubule walls become very inflamed and swollen. This can be seen as salpingitis, which is inflammation of the fallopian tubes. So the exudate, let's see if I can. So the exudate, so you have the swelling and inflammation in this area right here. It gets very inflamed, and this would be the salpingitis going on right here, getting very inflamed, and you get pus and you get all kinds of nasty stuff up and through this area right here. And then these little guys, these right here, the fimbriae, so what's going to happen is it's going to leak out, and start to drip on the ovary, and this dripping of the fluid of the exudate onto the ovary. So this can cause oocytes, I believe is the term, oocytes. So this dripping onto the overreaction is where the infection can spread. So and it can lead to peritonitis, or septicemia can even develop. Disruption of the vaginal flora from the original bacterial infection is where the access to the upper genital organs is going to be made. So yeah, this right here is not good, not good at all. So as far as the epidemiology of PID goes, symptoms really differ from case to case, and this makes it very hard for epidemiological studies to be conducted. In a study that was actually conducted by F. Grodstein and K.J. Rochman, it showed that young adults, quote, young adults have a higher frequency of intercourse, and a large number of sexual partners all increase the risk of PID, end quote. Some detriments that F. Grodstein and K.J. Rochman touched on in their epidemiology of pelvic inflammatory disease article were that in most cases the disease arose from STDs and contaminated contraceptives. And it sounds crazy, but yeah, contaminated contraceptives, man. If one's contaminated with some type of bacteria, and these two people end up using that contraceptive, that's just going to introduce a plethora, an unknown amount of bacteria into the genital region of the female, and that's just gonna make a complication of problems. So yeah. All right, let's see here. So it seems that diagnosing PID isn't too difficult. Some procedures that are conducted are a review of the records of personal documentation for the patient to check and see for a track record of potential predispositions or possible STD exposure. Just a medical record review, and then obviously a pelvic exam is going to be conducted. A culture could even be taken from the discharge to better examine the bacterial growth of the discharge. So if we take a culture and we find some bacteria that just should not be in the normal natural flora, the vaginal flora, that's kind of a red flag right there. Imaging tactics like ultrasounds and things of that nature, and even just delve in the possibility of an ectopic pregnancy. There we go. That's ectopic pregnancy. So that's going to be the one where the fertilized egg is actually outside the uterus, and that's going to just lead to a complication. So delve into the possibility of an ectopic pregnancy. So let's see here. So with PID being a bacterial infection, an antibiotic will be administered to help fight off the infection and just stop the possibility of that bacterium from spreading. Stephen H. Crossman from Fairfax Family Practice shows in his article, the challenge of pelvic inflammatory disease, that there are two common regimens of antibiotic administration, and different antibiotics falling within these categories. There is the parenteral regimen, which consists of Cevotan, Mefoxin, and doxycycline, and then the oral regimen consisting of ofloxacin and levofloxacin, with or without metronidazole. So these are going to be the more common types of antibiotics that are going to be given depending on the regimen that is administered. And that's the end of the slideshow. I really hope I kind of try to make it more of a just more of a teaching, kind of like if I were watching a video on YouTube trying to find videos on this specific disease. I'm actually in pathophysiology right now, and we were discussing this exact disease and found it very interesting, so I decided to do this one.